I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado. And this is a very interesting case. My client drove up from Lubbock? Amarillo. Isn't that the same thing? No, I'm kidding. I'm in trouble now. All right. He's 6'4", and he has had a CAT scan of the low back and pelvis, and he's had an MRI of the low back and pelvis. The hip views show probable labral tear on the right, and also a cam development of the right femoral neck. The good news is he has no hip pain. I tested hip motion in all directions, doing the typical hip and so-called SI pain provocation tests, and did not provoke any hip pain. He has some disc bulging and some degeneration in the facet and some narrowing of the lateral canal where the nerve root comes out at L5S1. The good news is he has no symptoms. Okay? And it said possible impingement on that nerve root, but the good news is that's not his pain complaint. His pain complaint is mostly the low back, and it's fairly symmetrical. Some left knee pain, and then some right upper tract pain. Do I have it? Mm-hmm. Okay. Not sure what caused this, right? Mm-hmm. But active childhood. Right. Alrighty, very good. He's had 4 years of chiropractic. How many? You saw 4 different chiropractors, and how many total visits do you think you had?
Some 3 times a week for a while, and some once a week.
Yeah.
For a very long time.
Yeah, so a lot of visits. Okay. And then you also had how many months of physical therapy?
3 months.
3 months, and that was how many times a week?
Twice.
Okay, alrighty. Okay. In standing, his pelvis is completely symmetrical per my ability to see with my eyes. I don't have a standing MRI on you or a standing 3D CAT scan, which would be lovely, but we don't have that. But with my eyes, he looks completely symmetrical on the front and on the back of the pelvis. When he lays down, he has equal leg length. Okay. When he stands, the femurs are symmetrical, so you don't have more flexion on one knee or more extension on the other knee. That presents symmetrically. Your hip range of motion is symmetrical, but the pelvis in supine is asymmetrical, in which this shelf is lower. This is what I named the anterior iliac shelf. So I'm guilty of adding new names. The ASIS is lower and more forward. And then the other name I've added is this flat part of the ilium, the back of the ilium, and I call that the posterior iliac shelf. When you're on your stomach, this shelf is higher. Okay? I cannot visually see that one sit bone is higher towards your ear. I can't see that. Okay? But what's interesting is that when he sits in the chair and he puts a 5 millimeter lift under the right sit bone, you're more symmetrical. You feel more comfortable. And I think the reason he gets symmetrical in his pelvis, and in sitting, his left femur is longer and the left tibia is taller, but when he sits on that pad, that difference straightens out. That becomes symmetrical. Okay? And so in standing, you have developmental asymmetry of the pelvis, and then that would basically move the acetabulum lower on that side and would theoretically cause your right leg to be longer in standing and in supine. But you compensate beautifully because the left femur grew longer and the left tibia grew longer. So that's how your body developed and gave you ultimate symmetry, with asymmetry of the pelvis on one side and asymmetry on the opposite leg. Okay? So we'll give you 3 pads, one to take home, one for your car, and one for work. Whenever you sit, you want to put that under there. And you've noticed that you feel more balanced after chiropractic treatment, and you sit on your bike and you feel more symmetrical for a period of time, but that never lasts.
Mm-hmm.
And I think that building up the bike seat by 1/4 of an inch is going to make a big difference for you. Okay, so maybe you could take it to an upholsterer and they can, you know, do a really nice job of putting that there. Otherwise, I would be using duct tape. And it wouldn't look, mine would not look pretty. I can't even tear it straight. I can't even cut it straight.
The right now solution, anyway, might be duct tape.
Yeah, the short-term solution. Yes, indeed. Yeah. Now, the other thing that we find normal movement in his pelvis in every direction, except that when he's prone, we note that the right sit bone is more medial. And we note that the left sit bone is more lateral and a little more posterior. Now, you have normal spring on that ischium when I go forward, but you do not have any motion when I try and spring the left ischium medially, or the right ischium laterally, or when I spring the right ischium medially, or the left ischium laterally. And that's a pattern I discovered. It's not in the pelvic sacroiliac literature. I call it a left lower windswept pelvis. So the lower pelvis is shifted over to the left. Now, I believe that this is a true movement dysfunction because I have restored normal spring mobility and improved the symmetry in some clients. In some of the clients, I'm not able to get symmetry of the lower pelvis, but I'm able to improve the mobility and improve their felt sense of symmetry, of normal, normal posture in that area. Okay? So I don't think I'm going to get symmetry, and we're talking in relationship to the midline crease of the buttock. We're talking about the lower sit bones being over to the right and the left one being a little posterior. I can improve that mobility, but I don't think I can get you symmetrical. Okay? So I think the long-term solution is I'll teach you some stretches to keep that motion. They're very simple. And then I think sitting on that pad is going to be very helpful to that process. So this pattern that you present with is called a left lower windswept pelvis. In the pelvic fracture literature, they also talk about a pelvic fracture that is called lower windswept pelvis. So just to distinguish, that's a different entity. All right. Now with this pattern, oftentimes there's a lower pubic rotation. So the left pubic bone usually rotates in which the lower part of it is distinctly posterior. You don't have that. Your pubic bones are completely symmetrical all the way down. Okay, and that if you had that pattern, then you would have blocked anterior spring on the left ischium. You don't have that. You have normal spring. Okay, this pattern also tends to cause the coccyx to side bent left. Your coccyx is sitting right in midline. Okay, and if I spring it on the left side, pushing it to the right, it has normal mobility. Okay, so you don't have the side bent pattern that oftentimes accompanies this pattern. Okay, you do have increased tone in this ligament. If the ligament was symmetrical, okay, then I would lean more towards this lateral thing being developmental. But because this ligament is tighter, the sacrotuberous on the left, then I'm suggesting that this is a movement dysfunction coupled with a developmental asymmetry. Okay? So I will refer you to other videos on YouTube in which I show the treatment for lower windswept pelvis. Okay? And I'm going to treat you now. And I'll stop filming. This is a long film. I'll actually go ahead and show the treatment in the next film. Okay. And I'm going to have you lay on your stomach and I'll demonstrate the asymmetry and the block motion. So go ahead and lie on your stomach. And you've always had this sense of awareness of your pelvis being asymmetrical, correct?
Once I went to the chiropractor, before I didn't realize anything was terribly wrong.
Okay, so he helped you become more aware of that part of your body?
Yeah, mostly by straightening my back.
Uh-huh.
I was able to feel that my hips were
Okay.
We're off.
Very good, very good. Alrighty, so his crease of his pants matches his anatomical crease, okay? And when I come to the outside of his sit bone on the left, I'm putting considerable force here and there's no movement. It should move the same way the pelvis moves when I do an upward spring. We should see this kind of movement, but we don't have any. And then when I hook medial to the right ischium, I'm pushing with considerable force and there's no movement. Now we find the same thing. The right sit bone doesn't spring medially and the left one does not spring laterally. And if you could bring the camera out here, you can fold those legs in. And then it's pretty significant, the asymmetry. Can you catch that with the video, with the camera view?
Mm-hmm.
Can you see that my right thumb is very close to his midline?
Let's see if I can.
And the left thumb is about 3 thumb widths lateral.
There we go.
Okay, good. So we'll stop filming here. I'll treat you and I'll demonstrate how I treated and then